Program's Ontario Trillium-funded Healthy Lifestyle Education Project. I'm happy to welcome you to the second part of the Stroke and Exercise educational webinar being presented through the Ontario Stroke Network. This webinar is one of several collaborative learning events being delivered by the VON SMART program and the partner agencies. The project goal is to help educate service providers so they in turn are able to better support their clients with special needs, in this case people living with stroke. Today's presenters are Sue Varelli and Marianne Thornton. Welcome. Sue is the Regional Community and Long-Term Care Specialist for Northeastern Ontario Stroke Network. She is a recreation therapist with over 20 years clinical experience in an inpatient rehabilitation program at Health Sciences North in Sudbury. She graduated from the University of Waterloo with a degree in Recreation and Leisure and is the current president of Therapeutic Recreation Ontario. She has been with the Stroke Network since 2010, and her role includes working with community agencies and long-term care facilities that provide services to persons with stroke and ensures that they have access to best practice. Sue also assists with the development of services across NEO in collaboration with community partners. Marianne is a physiotherapist with special interest in education of best practice in care post-stroke. Other interests include balance training, post-stroke and aerobic exercise prescription, and behavior change to decrease secondary risk factors post-stroke. She was recently awarded the title of Researcher with the Heart and Stroke Foundation Canadian Partnership for Stroke Recovery. Marianne is the current education coordinator for the Champlain Regional Stroke Network. So let's begin today's session with Sue and Marianne.
Thanks, Sheila. We're happy to be here today to do the second part of Stroke and Exercise. Our objectives this morning are to help you understand the benefits of exercise for persons that have had a stroke and why stroke-specific exercise class might be required within your facility or program. We'll look at how stroke affects the person's ability to exercise and talk about some specific precautions and safety tips that you would need to know as the leader of the exercise programs. Stroke can have many effects on a person, and each person can be affected differently by their stroke. Because of these different effects, it's important to have a program that will meet unique needs of the people with the stroke. It's important that the instructor has been educated in stroke and has an understanding of the potential impact that the exercise will have on this individual, and also understanding what the impact of the stroke is on the person's ability to be in their exercise program. We know that there's many benefits of exercise, and this is especially true for someone that has had a stroke. Our research shows us that people that have had a stroke that continue to exercise will improve their strength and balance. They'll improve their physical fitness. It will help them improve or even just maintain their performance of their everyday tasks. It assists with their quality of life and reducing social isolation, which we know happens quite often with people that have had a stroke. It also will help reduce the risk of having another stroke, which we call secondary prevention, and hopefully will also reduce the risk of falls. We want to talk a little bit about exercise and decreasing the risk of falls, because this is a very big issue for the people that have had a stroke. We know that they are at an increased risk for falls, and if they do fall, they are more likely to break a bone during that fall than someone that may have not had a stroke. This is especially true of their affected arm or leg. Regular exercise can decrease this risk of fall because it increases their balance and improves their strength. So being a part of your exercise class is very important for our people that have had a stroke and reducing their risk. Many persons that have had a stroke afterwards find they have a decreased endurance and increased fatigue. Their strength has been reduced, and they have problems completing their daily tasks. These can be tasks within their home, like dressing, housekeeping, that sort of thing, but they also have difficulty in moving around in their community. They may have to go to banks or go to places where they have errands. They have difficulty with walking upstairs. They may have difficulty getting in and out of chairs. So it's important for people that have had a stroke to continue to exercise to increase their mobility, and in turn this will increase their independence in their daily activities. The other thing about exercise is that it's a good social support for people that have had a stroke. Many people that have had a stroke are no longer involved in social activities or leisure activities because possibly they can't do them anymore, or they can't get out of their home or get transportation to get to these activities, and so they lose their social supports. And if this happens, we know it can lead to depression and decrease their quality of life. So we really feel that participating in group exercise creates an opportunity for increased social activity and support for our people that have had a stroke. And this can lead to overall improvements in quality of life and their decreased risk of depression. So I'll hand it over to Mary Ann to talk specifically about the exercising.
Thanks, Sue. So we'll continue with the slide that says warm up and cool down. And I want you to consider the importance and the value of having a portion of your exercise program devoted towards warming up and cooling down. Now, for usual exercise programs, this is pretty important, and I won't go into the rationale for that, but as exercise prescribers or people that lead exercise programs, we know that we need to have a little section to just give people a chance to get into the program and warm the muscles up, and then at the end to just relax and make sure they don't have spasm in the muscles as you finish the program. So for people with stroke, I want you to think about how much that might be different for them. What components of an exercise program for this population are going to be really important, and why is the warm-up and cool-down so significant? Well, on the slide we note that weakness or paralysis of muscles may be a problem, and that may lead to less responsive muscles. And they need time then for that warm-up and cool-down time to get the muscles engaged and to be active and ready to participate. Concentration and focus may be impacted by their stroke. So again, the time factor is really important to allow them to focus. Don't rush. And then there's the presence of cardiovascular disease to consider as well. So think about what things might affect the person's response to exercise after stroke. And three that we think are important for you to remember are that weakness, concentration, and the presence of cardiovascular disease. Be aware of these things, and then respect the signs of fatigue, shortness of breath, pain, and allow them some time. Each individual is unique, but these three things are quite common after stroke. The next slide, think for a moment about factors that will impact upon a person's ability to safely participate in exercise. We'll talk a bit about each of these things you'll see on the slide over the next few minutes. So we should be on how the stroke affects exercise. And there are 6 bullets on that slide that aren't appearing, but we'll go on. Let's start with balance. Now think about how balance would affect a person's response to exercise and how you, as supervisors of exercise, might deliver the exercise differently. If someone had a balance problem, would you be more cautious? Would the stroke survivor be more fearful? Stroke survivors may have that decreased balance, and they might then be at an increased risk of falls. And they might not be able to catch themselves or react fast enough to prevent a fall when they lose their balance. So a little tip is to be aware of the balance difficulties during the class and ensure adequate supervision and support to decrease the risk of falls. Think about that risk of falls, and if they are at risk of falling, it may affect how comfortable they are with trying the exercises, and it should affect where you stand to be supportive and improve their confidence. So now, where might you stand to be effective and helpful to them and prevent any falls? Think about distance, right, left, and front to back. So the slide that's titled Balance and Tips for Supervising Participants gives you an idea where you might place yourself to provide support. And in addition to these 3 things, think about having a wide base yourself. Your feet should be apart so that you might prevent their fall. Should they lose their balance, you would be in a position to be able to support them. So the keys are stand no more than an arm's length away. You don't want to be across the room, and you don't want to be bumping up against them. Give them room to move, but be at a distance that they feel confident that you're there. Stand on their weaker side, because if they fall, that's usually the direction they'll go, and slightly behind them. Again, if they fall, they'll usually go backwards. going forward, we tend to be able to protect ourselves. The next slide. Picture how a stroke survivor may walk now. Imagine yourself with a weak leg, a heavy arm. You might use a gait aid. Let's say you have a walker with front wheels and handbrakes that you're using. So as a person who supervises exercise, how might this affect your work? So think of this in two ways. You're the person with the stroke, and you have to manage with this walker. Now, your pattern of walking, if we think about it, you've got a weaker leg, so you might walk with smaller steps, more slowly and uneven steps. You might lean to one side. You have a weaker arm, so it might not swing as much, and there might be, in your weaker knee, there might be this snapping that happens with hyperextension when you put weight on it. And your weaker foot might not be lifting as high or as well, and it might not clear the floor as well. So now, as the person who supervised the exercise, how might that affect you? So here's, on the next slide, some walkers and some gait aids that people use. And we've picked that gait aid on the far left, the wheeled walker with handbrakes usually, to use as something to think about, consider. A lot of people will come into an exercise program, or could come in with this type of walker. Remember that the assistive device is for the participant's safety and efficiency. And be sure to encourage their use, the use of that device, and incorporate it into the program. What are some ways you might think about, or some things you might think of for safe use of a walker or cane? At what point do you put the brakes on the walker? Where should their hands be when they get up from the chair? And try to think about natural things that might help them. Sometimes people forget or try to do more than they should. So on this slide are some safety tips, some key tips to keep in mind with a walker. So like we talked about, putting walker brakes on is important. You're going to make sure that they put those brakes on before they stand up or sit down, and that they push off from the chair, not pulling up on the walker. And then they put their hands on the walker or cane. So I'm going to read through these points with you quickly. Key points. Participants should first push off from the chair, then put their hands on the walker or cane. Make sure they do not use their walker to pull or push themselves into standing. And that's simply because the walker can tip, it's unstable. If there's wheels that don't happen to be blocked, it's going to roll. So much safer to use the chair. Ensure participants remember how to use the brakes if their walker has wheels. And those brakes should go on before they get up. Or when they're standing, put them on before they sit down. And then ensure they don't push the walker too far out in front of them, that they stay within the frame of the walker. And then think about if you have weakness of your foot from the stroke, if you have difficulty lifting your toes off the ground when you're walking, what happens when you try to take a step and bring your leg forward? Your toe might drag and you could potentially trip. So that leads to some people having the benefit of a brace. And the next slide talks about what if you have what we call a foot drop. So here are some points to make sure that they use the brace well. A brace is not required to be on all the time. It's a tool, like the walker is a tool. And it can be used to help them be safe in mobility. And it can be good to occasionally remove that brace, move the ankle around, feel their foot on the floor, and just get some different feelings through the foot and more practice with range of motion and mobility. Braces should be in place and secure when a patient is walking, a participant's walking. Braces can keep the toes up and the ankle stable so it's easier and safer for the person to walk. Participants with a fixed brace can do some ankle exercise by loosening the top strap, but remind them to refasten that strap upon completion. And those with a hinged brace can do most ankle exercises while wearing their brace. Now, let's think about tone. What is it and how does it affect exercise? So we're on to the next slide. Tone is the resistance you feel when you try to stretch a muscle. When tone's decreased, a person's muscles appear limp and they may not work well and they may be flaccid, what we call is flaccid. When tone is increased, a person may have stiff or tight muscles We call that spasticity. And these changes in muscle tone can make it very difficult for the muscles to work because there isn't the usual synchronous movement and harmony and balance of work between all the muscles. Stiff or tight muscles may be hard to stretch, and they might not stretch as far as you might expect, or they might be, so it might be best to stretch them slowly and always within the person's pain-free limits. Where limp or flaccid muscles may stretch very easily, and stroke survivors must be reminded to be careful not to stretch them too far or too quickly. So it's good to know what to expect when someone has one of these conditions and to think about how this might affect their response to exercise. What would you do differently for someone with high or low tone? The next slide has fatigue and exercise as the title. Attending a regular fitness class may be difficult because fatigue caused by the stroke may make it a challenge to keep up with the class, and ultimately this may become frustrating. The task that you ask them to do may not look as smooth or coordinated when they are doing it, when they do an exercise or activity if they are fatigued. And the task, there are 3 signs of fatigue listed on this slide, and they are loss of balance, might become more apparent as they become more tired. They may catch their toe of their weaker leg on the floor or step, and they might lean heavily on the walker or the cane. That might be more noticeable as they get more tired. They could have uncontrolled movements, this kind of plunking down into the chair where they just don't have the fine-tuning control of their muscles to let them sit down with control. And they may have shortness of breath. So it's important for you to know that the participants may require regular rest breaks throughout the class and to just be tuned into those signs of fatigue to recognize them and encourage rest breaks as needed. The last point we're going to talk about is shoulder pain. Now, it may not be something that comes to mind when you think of a stroke, but it is quite common for people to have soreness in their weak shoulder. And 3 reasons for the pain are listed on this slide. Often it's simply the weight of the arm pulling on the joints and moving them out of their normal position. So it can be caused by the tendons or soft tissues getting pinched or torn in the joint. The shoulder can become stiff, or often known as frozen shoulder, or the shoulder can become subluxed or out of its normal position. Now think for a minute about how that would affect your participation in exercise if you had a sore shoulder. And what can you as a person leading an exercise routine do about that if someone walks in with a sore shoulder? So the next slide talks about the pain and the exercise piece. During exercise, instruct participants to remember to start each exercise with good posture. Avoid slumping forward. Because of the impact of the weight of the arm affecting joint alignment, start exercises with that good posture to align the joints as much as possible first. I'm going to get you to try a little activity here by sliding forward in your chair, slumping down, just lean back into the chair now and let your shoulders curl forward, and then just let your head go down to lift your arm, lift one arm up as high as you can and hold it there. Don't move your trunk. Now hold your arm up there, kind of note where it is, and sit up tall and do the same. Go back as far as you can. And I don't know about you, but I can certainly move my arm much further, quite a bit further when I sit up taller. And the arm may feel less heavy. So that's one way to know that if you can get them into a little better posture, they may just perform a bit better. Their arms may move a little better with more pain-free range. Even though that range might be more, though, stay within a comfortable zone. Respect pain and have them listen to their body and respect that pain. Don't push through pain. Keep their arm movements at or below the level of their shoulders if the weaker arm is limp and needs help from the other arm to exercise. So if you're sitting and your arm is down by your side, and we call that 0 degrees, don't have them lift it beyond 90 degrees. Another trick is think about keeping their palm up when they raise their arm. So if you put your arm by your side, turn your palm up, and then lift the arm, again, it keeps the joint in better alignment. So one more reminder, use pain as a guide, keep their arm below the level of the shoulder, and palm up to align the shoulder better. Next slide. And I want to reinforce a couple of things. Sometimes there's a tendency or an interest in using pulleys to work with people that have arm problems or wanting to get more range out of their arm, but this isn't a good idea for people with stroke. So try not to pull on the participant's weaker arm. Do not use overhead pulleys, not advisable, and there's good references as to why that's not a good idea. So try to have their arm supported rather than any weight on it or pulling on it. And some stroke survivors may wear braces or slings to help support and protect their shoulder. Follow the advice of a healthcare provider about removing the sling or brace for exercise. There are times that that brace is important to keep in place if the pain is very significant. So if they have a sling, follow the advice of the healthcare provider and respect pain as you're asking them to move. I'm going to stop there and pass it back to Sue for the next part of the presentation. Thank you.
Thanks, Marianne. So now we're going to move into other important considerations that we'd like to review that you might want to consider when you're doing an exercise class that includes people that have had a stroke. The first area is environmental considerations. So in thinking about your program, start thinking about it from the time that you get to the facility, you know, driving there, what's the parking like, is the building accessible, is it easy to get to? Think about the change facilities. When you arrive, are you already dressed and ready to go, or do you need to access change facilities? Many programs offer general orientation, so what the people will be aware of what they need to do, what they need to bring with you. For example, do they need a lock? If they need a lock, it's better to have a lock with a key rather than trying to remember a combination for a lock. And also consider cost. There are many community centers like the YMCA that will provide a financial assistance to people. And we know that money can be an issue for people that have had a stroke, especially if they've had to stop working because of their stroke. So we're always looking for cost-effective programs for them. Think about the emergency plan and the emergency equipment that's available at the facility that you're in. You want to be aware, first of all, of medical conditions of your participants, and often the center will keep emergency contacts on file for participants in their programs, so you need to be aware of where that is. There's many community centers that have a documented emergency preparedness plan, so make sure that you're familiar with the plan at the site that you're doing your exercise class, and really remember to look at their CPR and first aid references. As well, typically places will have phone access to emergency medical services, so a straight line to 911, so make sure that you know where that is. Be aware of warning signs of when people shouldn't be exercising. For example, if their blood sugars are too low, their blood pressure is too high, you need to be aware of those things. And many facilities now have the automatic external defibrillator, and so you want to make sure that you know where that is and you know how to use it. So just to summarize the considerations for your class, you want to be working in a facility that's barrier-free and encourages safe participation for people with a stroke, especially with the varying degrees of limitations that they might have. This might include ensuring that training environment is wheelchair accessible and has adequate space for people to transfer to and from their equipment or their chair. Consideration should be given to temperature of the exercise room because you want to safeguard against things like overheating and dehydration. They recommend temperatures should be kept constant, and of course we always encourage our participants to bring bottled water. It's also good for your facility to have a source of glucose in case you need that as well. As well as the person running the program, you need to be prepared to respond to emergency situations, which includes things like following the Canadian Fitness Safety Standards, and as well as knowing who the in-house personnel that are trained in first aid are at the facility that you're working at. And once again, having an AED is highly recommended for any environment that you're working in. You need to consider, in terms of safety, when you should recommend that people immediately stop exercising. So you have to be aware of the participants in your class, and you have to take note of things like chest pain, tightness or heaviness in the chest, clammy or cold skin, unusual shortness of breath, dizziness, lightheadedness, nausea, vomiting, headache. I believe that the VON does have some messaging around this area, so you want to make sure that you're familiar with their messaging on this. And take note if they stop and rest and these symptoms don't immediately go away, then it's probably the time where you should call 911. And even if your participant is not interested in you calling 911, it's something that you should still do. And once again, the VON has training policies around this, and make sure that you're familiar with these policies. The next slide, recently they've changed the signs of stroke, and the Heart and Stroke actually has a new campaign out to make people familiar with the new wording for the signs of stroke. The new acronym is FAST, F-A-S-T, and as you can see by this slide, F stands for face, so you look at the person and see if their face is drooping. Then you have a look at their arms and see if they could raise both of their arms. Finally, you look at their speech and see if they have slurred speech or jumbled speech. And the last one is time. So if you notice any of these signs, then you should immediately call 911 to act as fast or as quickly as possible. It's important to get people into the hospital by ambulance. The ambulance knows stroke protocol, and therefore they shouldn't be driven to the hospital. They should actually go by ambulance. And it's important to do it quickly because for some people they may be eligible for a clot-busting drug called TPA, but you need to be in and receive all the testing, and then if you're eligible for the medication, you need to receive it within 4.5 hours. So time is of essence. So FAST is the new acronym to keep in mind when you're watching for the signs of stroke.
Sue, can I mention something really quickly here?
Yes,
I'm thinking with that acronym too. The other part of time is note the time that this started, because that's a factor that would be important to report as well. In order for the clot-busting drug to be used, they need to know that start time.
Exactly, exactly. So they know if it's been within 4.5 hours. Thanks, Marianne. Finally, we'll talk about starting your class and some of the safety procedures and questions that you should think about. So generally, at the beginning of every class, you should check in and ask if everybody's okay and if they've had any changes since the last class. And then these are some of the questions that you should consider asking your participants at the beginning of each class. So were you tired after the last class? Were you unable to sleep? Were you excessively sore? Did you have any falls? Did you experience any pain in any of your joints? And you can name some of these joints. And also ask if they've experienced any change in their health status since the last class. If your participants are reporting fatigue or joint pain, you can help modify the exercises appropriately for them. But if there's a significant change in health status, or they've experienced one of the signs of stroke that we've talked about, or a warning sign that they might require some medical care, they should be assessed and cleared by a healthcare professional before they resume your exercise class. Please keep those things in mind. So in summary, today we talked about areas that are affected by the stroke in individuals, including movement, sensation. They talked about thinking and vision, communication, fatigue, and emotion, especially including depression. We've also talked about the benefits of exercise, for persons that have had a stroke, and these benefits include improving their balance, improving their strength and coordination. Very important one is decreasing that risk of falls, because they have a higher risk of breaking bones if they've had a stroke. The benefits of just the increased social interaction, once you're exercising on a regular basis, you decrease your risk of a secondary stroke, and you improve your cardiovascular fitness. Also remind you to remember when you have people that have had a stroke in your exercise class, like Marianne said, you have to have sufficient time for your warm-up and cool-downs. You have to adjust exercises according to increased or decreased tone, so if they have a flaccid limb or a spastic limb. You need to use special caution when dealing with shoulder exercises, especially on the affected arm. You have to allow for the possibility of your participant having increased fatigue or decreased endurance during your class, and provide rest periods if needed. And you have to recognize balance issues that people have and adjust accordingly. So in the slides, we've included some references and some websites that you can go to for further information. There is a guideline for community-based exercise programs for people with stroke that came out in October 2010 and is in the process of being updated at this point. You can also go to the Heart and Stroke website, which has a variety of information available, including their tips and tools manual, which is a manual for front care providers like yourselves that maybe want to learn more about some of the results of stroke and how to deal with certain areas of stroke. So it's an excellent resource that you can look at online, or you can order a hard copy of. As well, there's a website that has a book called Let's Talk About Stroke that you can go and look at and order as well. And the final one is the Fitness Instructor Training Program. So it's community-based exercise for people living with stroke. And it comes out of our partners in Northwestern Ontario. And you can go to that website and read the information that's available there. So Marianne and I would like to thank you for listening to us today, and we hope that we were helpful in educating you around stroke and exercise.